I always say that the public health crisis is not vaping, it's smoking. There's a million people estimated in Canada, 3 million in the UK, 10 million in the United States. There's a lot of people that are vaping. A natural experiment has already been unleashed, and none of this is happening. We haven't seen this. Cohen described it in the 70s. I mean, this is moral panic. This is like textbook what happens. It's really based in a deep-seated stigma and discrimination against people who smoke. So they're basically expendable. So we already know that people are using these. We know that the health impacts of smoking are tragic. Even if they don't get lung cancer, a lifetime of smoking is very detrimental to your well-being. And so, but somehow, since that's been happening for decades, public health doesn't really feel any inclination to try to help that segment of the population. I come from this by working with people with other addiction issues who basically all smoke cigarettes. And, I really came to this honestly that there is nothing on the table to offer people in those situations. They will all continue to smoke unless we can offer them something new. And vaping to me is the only new thing we can offer them. And just sitting back and saying, people should just quit, or here's a lozenge, it is crazy to keep thinking that is all we can do when there is something much better out there. We should also talk about prohibition and banning. So any topic that comes up that our answer is banning something is heading for disaster. So we know from prohibition it doesn't work, and most of the problems that have happened among youth in the United States with these illnesses and deaths are directly related to prohibition. So certainly the answer is not banning things, because that's just asking for a disaster.